are here with Dartmouth Health, and Ryan from Dartmouth Health. Thank you for your time. Really appreciate taking a few minutes with us here. So the first question is real easy. So give us a sense for your hospital, like size, scope, number of beds.
Okay, so we are a kind of a conglomeration of regional hospitals. We have a primary hub that's we call Dartmouth Hitchcock Medical Center, DHMC, and that medical center is around 450 beds. And then our regional members vary in size, but it's another couple hundred beds as well. Yeah.
Okay, good size. Okay.
Yeah.
So what was your most recent Connexall implementation?
So we have implemented Connexall just at our main DHMC facility, and we have it implemented in all of our med-surg floors, where we utilize the integration with the Masimo patient safety net monitoring. And then also we have a pilot in the one of our Philips monitoring units, a step-down critical care, the ISCU department.
Okay, cool. And so what were you looking to achieve with Connexall implementation originally?
One of the primary goals is reducing alarm fatigue.
Yeah.
Another goal of ours was to get away from the pagers. We recently have implemented the secure chat and Rover through Epic, and so we're trying to consolidate the number of platforms that the nursing staff have to utilize in order to conduct their job.
And do you feel that so far those objectives have been achieved and we're heading in the right direction?
Yeah, so far I believe that that is the case. More so I would say on the med-surg than on the ISCU department. That one has been a little bit more of a challenge in the implementation. The med-surg units are much larger, more spread out. It makes kind of a lot more sense to have the notifications sent to the nursing staff, whereas in this particular implementation in the ISCU, it's a much smaller unit, and you can physically hear and see the alarms happening from any of the rooms in any location from within the department.
Okay.
So yeah.
I'm sorry about that. Okay. Let's see. The next question here, and I'll just read it. So tell us about capsule data capture, smart links, servo ventilators, patient monitor workflow. That's a mouthful.
Yes, it is. So the data capture capsule middleware integration is it's a middleware solution that we utilize to send the HL7 device data from the respiratory therapy ventilators into our EMR. Okay. And so that is another implementation phase to our Connexall rollout that we're looking to potentially do in the not so distant future.
Is that the type of flow we would like to have?
I think so. How do you use Connexall in that?
So we would be utilizing Connexall by delivering the alarming from the respiratory therapy vents to the care team, specifically the respiratory therapists that are taking care of those patients. So they're not always on the floor for all of the patients that are on these ventilators, and so that would be kind of it would be a means by which to indicate to them that there might be a potential issue with the vent or there's an issue with the patient.
So it's the feed. We're tapping into the feed.
Yes.
That's coming out, but we're not part of sending it.
So Connexall would be receiving the alarm feed from the capsule middleware solution.
Correct.
Right.
Yeah.
So the alarming would go from the device to the capsule middleware solution, and then from there to Connexall.
And also from there to
the EMR. From there to the EMR or to the nurse. Yes, exactly. Yeah.
So we turn the data into an alarm, basically, or.
It's not necessarily turning the data into an alarm. It's more capturing the alarm from the device, which in today's world, we're not capturing that at all.
Okay.
So yeah, it's it would be an enhancement to what we currently integrate from these devices today.
Oh, so you don't have that yet, or you're?
We do not have that yet.
Oh, but you're moving towards that?
Yes.
Okay, because that would be really interesting. Because I haven't heard about that very much.
Yeah.
People doing that, so that's pretty cool.
Yeah. We're looking forward to it. I think it's going to be kind of interesting. It'll be an interesting implementation, but I think that it'll be beneficial for sure.
When are you thinking of rolling it out?
We will likely start with we have a number of things on the list of integrations for Capsule, or excuse me, for Connexall. That is it is on the list. It is not next in line.
What is it?
Nurse call is kind of what our next kind of piece would be, and then also a phased rollout, because our primary physiologic monitoring system is the Philips PIC-IX or PIC-4 system, and we've just piloted it in one unit, and we have that across the board. So we would likely implement that to other departments, and then work towards the nurse call kind of in tandem.
So, but currently you're not using secondary notifications from PIC-IX or from Philips, or you are?
We are not.
Okay.
Yep.
Yeah, makes sense.
Yep.
Do you find the RTLS suppression of secondary alarms effective in reducing alarm fatigue?
The RTLS suppression of alarms. I think that may have been one of the enhancements that we would like to do. We do not integrate with RTLS at this point, but that is something that I think would be beneficial to our facilities.
Okay.
Yeah, it's an in-touch care gateway, co-location suppression alarms and dispatching.
The closest caregiver. I guess when you start dispatching alarms, then you'd want to maybe look at dispatching to the closest caregiver.
Oh, well, it would be potentially like a potential use case would be not necessarily for, like, I know that with the Connexall integration with RTLS or Centrax, you can have an alarming or have a patient that has an alarm and then dispatch the alarm to the proximity driven kind of alarm dissemination, where the 3 closest nurses would get that alarm for that particular patient. I don't know if that's something that we would necessarily implement, but maybe something along the lines of where if, say, a patient has been alarming and the alarm has been, or the nursing staff has been notified of that alarm, and now the nurses acknowledge that alarm on their phone, but then have gone into the room. If the alarm is still persistent, regardless of whether they've silenced it on the monitor or not, you don't necessarily need to then deliver that alarm again to the nurse's staff. They're literally at the bedside, so they don't need to be hearing it on the monitor and on the phone at the same time.
Yeah, that's annoying.
Yeah, that would be, I think that is going to be one of the biggest kind of benefits of integration with the RTLS system.
Yeah,
for sure.
Yeah, you're absolutely right.
Yeah.
It makes a big difference.
Yeah.
And then I think what was it? Dispatching alerts to closest caregiver. We just talked about that. Okay. There we go. Do your clinicians find Epic Rover effective for managing secondary alarms?
They do find it. They do find it helpful. Yes, it is. It is. As you know, it's a fine balancing act between notification and alarm fatigue. Talking a lot with what they were talking about today, where it's like you have different tones for different things, but then if it's a real alarm, it's something where it's like they really need to pay attention to it. And if you've become so desensitized to the ever dinging devices, it's one of those things where it's like having it. If you're in a space that is just constant noise, having something that is that is directed towards you can be beneficial.
Sure. Do we discuss this already? Tell us about your Massimo patient safety net implementation.
We didn't discuss it. We're just
mentioned
curious
it,
about it. Like, what is it?
Yeah.
And how does it work? And
so the Massimo patient safety net system is akin to Philips PIC-IX system. So it's a monitoring system that centralizes a display of what the patients are exhibiting for their vital signs like heart rate and SpO2. And then also that system will, in the past, we've used it to disseminate alarms to paging system, but now we utilize it to send to the Connexall alarm management system.
So is it a completely automated process, or does Massimo have screens somewhere and there are people monitoring them, or it's just like a box?
It is. I mean, it's like a Massimo route with like a Radical 7 is akin to a Philips MX550 type of deal. It's a lower acuity monitoring system, but it still has the same type of capabilities as far as monitoring the different vitals.
Okay, but you're using Massimo monitors then
Yes.
too. Okay.
Yeah. So the safety net system is what ties all the monitors together to a centralized location.
And then dispatches alarms from there.
And then dispatches not from the central, but actually from a server. So we have, say 5 different units, med-surg units. Each unit has its own central station in which all of the monitors on that unit communicate to that central system. That central then communicates to the server, and then from the server, those alarms are then dispatched from the server to Connexall, and then dispatched from there on through to the clinicians.
And that's happening now? That's
happening
active?
now. That's active now.
Okay.
Yeah.
Yeah, so that workflow would be really interesting, because I've noticed there's a couple others that have the Massimo Patient Safety Net, but I actually wasn't aware of what it was. So that's pretty cool.
Yeah.
So
Yeah, it's very interesting.
what sort of a workflow, like what kind of alarms are you dispatching? Do you know, like just critical alarms or all of them? Or?
Not all of them, but we basically took the alarms that we were dispatching to the pagers, and the time settings, the suspensions that we had set, we took those and we moved that over and correlated that to the Connexall system.
Okay.
And basically, so we have there's low SpO2, low heart rate, high heart rate. There's low battery. There's leads off. There's a number of different things that we do.
Do you send them all?
We do not send them all.
Oh, bless you.
Yeah. No, we do not send them all. But the ones that could be considered pertinent or a patient safety issue, we do send.
Okay.
So the final question is, from your perspective, what is the greatest benefit of Connexall to Dartmouth Health?
What's the greatest benefit? I think, honestly, in the ever-growing world of nursing and how they have what seems to be an endless list of patients and needs, giving them the ability to focus in on the alarms that truly matter is really kind of where we benefit from Connexall's implementation in our facility.
Love that.
Yeah. Thank you.
Yeah, nice answer.
Thank you very much.
Yeah.
That is awesome.
Do you want to ask last?
I will.
Oh.
Oh, well, yeah. So basically, for promotional purposes, is there anything here that if they're going to do like a social media post or something, would you be open to that?
Sure.
From what you're saying? Okay. But we would send it to you first for your approval.
That would be very much appreciated.
Yeah.